asked students at the University of Cincinnati what comes to mind when they hear the word homeless.
I think of people that are hungry and cold and have nowhere to go at night and in a way are suffering.
I think of criminals.
Highway exits in Cincinnati.
I think of drugs.
Gentrification.
I think of loneliness.
Depression.
I think of safety.
To get all of the true answers, I interviewed Mr. Finn, the founding president and chief executive officer of Strategies to End Homelessness.
Homeless means a lot of different things to a lot of different people. The world I operate in, we tend to go by what the federal government considers homeless, more specifically the Department of Housing and Urban Development, where they consider a person to be homeless if they are sleeping in a place not meant for human habitation, so that's one, a resident of an emergency shelter, so that's two, and then the third would be fleeing domestic violence. So for short, we always refer to that as either on the street, in a shelter, or fleeing domestic violence. So most of the data on that I would share with you too, like that's who it's talking about. As Strategies to End Homelessness, we sort of have three goals that we're working on simultaneously. So we want to prevent as many people from becoming homeless as we can. So we have prevention programs that do that. Then we want to provide a high level of assistance to people who are already homeless, so that they can get out of homelessness. We don't want people to get stuck in homelessness, so providing all that assistance is necessary to get people out. And then the third thing is, like, there are some people who will never get out of homelessness if we don't offer them some kind of supportive housing. Whether it's a rental subsidy for a little while or something like that. Some people need that level of help in order to get out. So we also oversee housing programs that get people out of homelessness. So again, we try to prevent as many people from becoming homeless as we can, provide a high level of assistance to people who are homeless now so they can get out, and then have solutions in the form of housing programs to help other people. The reasons why people are homeless are also not what most people expect. So the number one cause of homelessness, number one far and away, is just the lack of affordable housing. So here in Cincinnati, we are surrounded by people who are working and putting 60% of their paycheck, or maybe even 70% of their paycheck, into paying for their housing. Well, the rule of thumb as to what you should spend on your housing is about 30% of your income. Like when you go to buy a house or something like that, that's what they tell you. So we're surrounded by people who are way overextended just trying to pay for their housing. And that puts them at risk of becoming homeless, even if they don't necessarily realize it while everything's going fine, while they've got a job, while they're getting plenty of hours at work and all that sort of thing. But what's the one thing you can't pay for if you're putting 70% of your income toward it, when all of a sudden you lose your job or your hours get cut or whatever the case may be? So the fact that people have to pay so much of their money just for housing because the housing is so expensive, that's really the biggest reason why people are homeless. Let me stop for a second and ask you a question. So I'm giving you sort of long answers.
Yeah.
Would you rather I gave you short answers?
Nope. I like the long answers.
Right.
Yeah.
Perfect.
No, thank you for a lot of information.
Another big reason why people are homeless here in Cincinnati that most people just never think of is our public transportation is terrible. So like where poor people and homeless people are is not where there are jobs available. And where there are jobs available out in Westchester and places like that, people who really need jobs can't get there because there's no good public transportation. Unless you want to spend 4 hours a day on a bus, you can't get to Westchester to work. So I would argue that second to the lack of affordable housing, the awful state of our public transportation is a big reason why people are homeless. And then you get down to things that people tend to think of. So, less than half of our homeless population has a drug or alcohol problem. Less than half are mentally ill. Most of our young homeless people didn't age out of foster care. A lot of the reasons that people think of as like that's why people are homeless actually affect way less than half of the homeless population. Whereas things like the lack of public transportation and the lack of affordable housing, they affect everyone who's homeless. Sometimes they affect people on the front end, and those are a reason why people are at risk of becoming homeless. But things like the lack of public transportation and the lack of affordable housing also make it much harder for people to get out of homelessness after they've been homeless. A job and an apartment is what would guarantee that somebody doesn't become homeless again, and we just don't have easy access to those things here. Too soon to know. In 2019, we have to see the data through the end of the year in order to be able to say if it's gone up or down. But the number of people, last year was actually the first year that we saw a decline across the board. We had fewer people on the streets, we had fewer people in the shelters, and that led to an overall decline. Prior to last year, what we had mainly seen was the number of people on the streets going down, but that might have been counteracted by the number of people in shelters going up. But 2018 was the first year that both of those went down, and obviously we would hope that it continues to go down in 2019. Most people's experience of homelessness is not what stereotypes would indicate. So last year we had a little over 7,000 people who were homeless, and that's an unduplicated number. But on any given night, we have 700 to 800 people that are homeless. So in order to have 700 people on any given night, but an unduplicated 7,000 people in a year, that means the homeless population turns over completely about 10 times in the course of a year. So homelessness is actually, for most people, a pretty short-term crisis. It's not a long-term situation. So the average person who's homeless locally is homeless for 30 to 45 days. And 90% of those folks get out of homelessness on their own. They don't need a program or an intervention or something like that to get out of homelessness. 90% of people get out on their own in a month or month and a half. But the people who most people in the community tend to notice are the people who are homeless the longest, because they maybe see them over and over again or things like that. It gives people the impression that homeless people are homeless for a long time, but that's really just not the reality. Well, regarding people staying on the street, a couple numbers I think pretty well answer those questions. So the national average is that 34 or 35% of homeless people are sleeping on the streets, and the rest are in shelter. Locally, last year, 14% of our homeless population was found on the street, and 93% of our homeless population stayed in a homeless shelter. Now, that adds up to more than 100%. That's because some people go back and forth between the street and shelter during the course of the year. But again, only 14% of our homeless population was out on the street compared to 34 or 35% nationally. So we actually have a lot less people on the street than the average community around the country. There are times that it's difficult for people to get into shelter, particularly families. The family shelters are really the part that can be the hardest to get into. But again, I would really point to the lack of affordable housing as the problem. If people could get out of shelter and into reasonably priced housing faster, then the shelter beds would turn over more quickly. They'd be available to more people when they're having a crisis. So I don't think the answer would be to build more shelters, because people don't want to be in a shelter. The answer is if we just had more access to affordable housing and people didn't get stuck in shelter for as long, then we'd have plenty of shelter beds. I mean, if you just think about it, if you just think about it, if the average length of stay in shelter was 15 days rather than 30 days, effectively we have twice as many shelter beds. Well, 55% of our homeless population is under the age of 35. So I think the average falls right at like 32. And that's sort of another myth of homelessness, that people tend to think it's older people than that. But it has become a significant issue among young people. So 25% of our homeless folks in Hamilton County are children. 40% are under the age of 25, and 55% are under the age of 35. So it is sort of you may not think 35 is young, but I do. So it disproportionately affects younger people. But then on the opposite end, we've also seen a sort of uptick in senior citizens being homeless. So homelessness sort of seems to be, age-wise, is kind of heading to the extremes. You have more people on the young end, more people on the very old end, and sort of less people in the middle. The issue with the controversy about homeless camps last year was unlike anything else I had ever seen, because first of all, you have to, as I already mentioned, we actually have far fewer people on the streets than most communities do. And that context was sort of completely lost from the coverage of homeless camps last year. So that's one thing to just sort of keep in mind. But the other thing that was strange about it is everyone was correct. Everyone was correct. Some of the advocates for homeless people were saying that the shelters were all full, and they were. They were all over capacity. But the mayor and the county prosecutor were saying that the people in the camps could have gone into shelter if they wanted to. And they were right. They could have. Just because the shelters were full did not mean they were turning people away. A lot of the shelters were, fine, like they do all the time. They were finding additional space for people. They were letting people sleep on mats on the floor if there weren't beds available. So people were not being turned away. So everyone was correct that yes, the shelters were full. They were actually over capacity. The reason they were over capacity is because they were still letting people in. So the people who were saying that the folks in the camps along 3rd Street could have gone into shelter, they were correct too. The thought that homeless people don't work is very much a myth. Actually, about 40% of our shelter residents are employed while they are staying in shelter. I would argue that many of the others are not staying in shelter for some pretty good, who are not employed while they're staying in shelter. They're not employed for some pretty good reasons. People who have health conditions and mental health conditions that really make it difficult for them to work. But also, it's very difficult to live in a homeless shelter and get up and go to work every single day. So there are actually more people that were employed when they became homeless, but did not manage to continue working once they were staying in a shelter. So a very large percentage of homeless people do work or even were working at the time they became homeless. The real problem there is, again, when you do the math of what a person might make working at a job, getting paid minimum wage, and what an apartment costs, it's really hard to piece that together. And for those people who are working while they're homeless, it's just really difficult to save up enough money to pay a deposit and first month's rent to get into an apartment. But many homeless people, in fact, are working. So that is very much a myth about homelessness. About 12% have an alcohol problem, and about 25% have a other drug problem. And there's obviously a lot of overlap between those two groups. So it's way less than half that actually have a drug or alcohol problem. So that's very much a myth. Well, like we talked about before, we're doing much better than some communities in terms of getting people into shelters. So 93% of our people experiencing homelessness stayed in a shelter last year, compared to 35 or so percent being unsheltered nationally. A lot of times what people picture of a homeless person is a person out holding a sign asking for money and that sort of thing. And that image of that being sort of the average homeless person is another myth of homelessness. Not only are most of our homeless people not on the streets, actually we did a survey about a year and a half ago, and 2/3 of the people out holding signs asking for money are not homeless by their own report. So most of those folks that are out there, who people tend to look at and think this is the face of homelessness, 2/3 of those people are not actually homeless. But people look at somebody holding a sign asking for money and they think that that's what homelessness looks like, which is a real injustice because, like as we've already talked about, a lot of homeless people are really kids and their families and their things like that. So what I would encourage people to do first is not to give money to people who are out on the streets just asking for money. And instead, if they're going to provide financial support to address homelessness in any way, to give that money to an organization that has an established track record of helping homeless people. Because those organizations are accountable for where that money goes. They have to report out on where that money goes. They try to be very efficient with how they use those dollars. And when you hand money to somebody on the street, there's a 2/3 chance you're actually not even handing it to a homeless person. So the first thing I would say that people can do to help homeless people is to actually give to where homeless people are, which is not giving to people who are out asking for money on the street. Beyond giving money, it is not in any way a stretch to say that if people volunteer and do things for homeless service agencies with their volunteer time, that literally frees up dollars that those agencies can use to put people into housing. So if a shelter tonight has to pay somebody to cook a meal and serve a meal to their residents, that money they paid is now no longer available to pay a deposit to move somebody into an apartment. So the second thing I would say that people should do to help the homeless is volunteer. Because if people are willing to volunteer to do things like serve meals and stuff like that, you're literally freeing up resources that can then be used to help a homeless person get into an apartment and things like that. So that is the second thing that people can do. There are also things that people tend not to think of, like, there are a lot of people in town who own, they have a house they live in, but they also own some rental property that they rent out to others. On any given day, we have 100 families that have a first month's rent and deposit in their hands, but can't find a landlord who will rent an apartment to them because of the sort of stereotypes that landlords might have in their heads about people who've been homeless and that sort of thing. So another very tangible thing that people can do, particularly people who have rental property or know people with rental property, is to make even just one or two of those apartments, maybe 10% or something, available to people who have been homeless, because what people really need to get out of homelessness is they need somebody who's willing to rent them an apartment, something like that. And since homelessness is not all drug addicts and it's not all alcoholics, and it is families and young people that just need another chance or something like that, I feel like if landlords in particular, if they really understood who is and who isn't homeless, they would be more likely to make their housing available to people who have experienced homelessness. So that's another thing that at least some people can do to help out.